Okay.
Did you already start? Hey guys, it's Dr. Nagel. I wanted to bring you another case about hyperbaric. This is Julie. So Julie actually called us the other day. She's got, had COVID, and since she's had COVID, has had major anxiety, right? And she had some symptoms before that were kind of MS type symptoms. So she was actually calling us about that, right? Where you just kind of pass out. I mean, there were times where family thought she wasn't going to make it, and but things have been really bad post-COVID, and I wanted to talk about this because we've actually, Aaron and I have done a lot of training on this, and what happens is that cytokine cascade that creates like this long hauler situation. Sometimes people get clots in their lungs, but in the brain it can cause like anxiety and panic disorders and all kinds of crazy stuff. So if you can, hyperbaric does a really good job of bringing those cytokines out of the brain. Similar situation with like traumatic brain injury, you have those cytokines. Lots of the injuries that we've talked about before. So in Julie's case, she came into the office 2 days ago, and she was like actually kind of passing out in the, we'd have to catch her and carry her back. And so you've done 2 hours of hyperbaric.
Yes.
Right? So yesterday you had a great day, right? And then today we had a little bit of struggle ramping you up, but then how do you feel now? You just got out on your second hour.
I got out, and while I was in the machine, I texted my husband on the outside saying, I literally feel alive and happy, and I haven't felt anything like this in 4 months. I've been almost like having the effects of feeling hysterical on the inside, so much anxiety, and my brain just wouldn't connect with my body. I would say to my husband, if someone could just connect those wires so that my brain could actually be with me. I felt out of my body sometimes, and it was just it's been a hard 4 months where I didn't know if I was gonna survive.
Yeah, so these cases, we've had, COVID's everywhere, and so we've seen a ton of post-COVID cases, and sometimes they're like Julie, and sometimes it's breathing problems and blood clots and things like that. But with the brain stuff, I can't tell you how many patients we've had come in that have had, never had anxiety in their life. And she has some underlying toxicity issues that I'm not going to go into, but what it does is it takes your weak link, right? It takes the weak link and it exacerbates it like crazy. So anyway, this is not the end-all be-all for your symptoms. We've talked about that. There's some toxicity issues that we're going to address head-on. But what it does is it puts her body in a position where we could, it would be really hard to do like some of the functional med approaches because she's so sensitive to everything. So this brings down some of that inflammation. The excitatory neurons kind of calms everything down in the brain, and will allow her to be a little less sensitive so that, we can get some work done on the other issues. So hyperbaric post-COVID, there's new research on it. Obviously COVID's new, so it's not a huge body of research, but it's super helpful. So if you know anybody that are having those symptoms, send them in.
Okay, happy for you, Julie.